Hello, welcome to today's video. Today we're going to go through the Occupational English test, and we're the practice version. And all of this, including there's 10 pre-made exams, including you can custom make your own exam. All of this is available at app.occenglish.com. And yeah, I'll just quickly go through what we're going to do. So we're just going to quickly go through the first 3 sections in the pre-made exam 1 today. We're going to go through the listening, the reading, and the writing section today. All right, so it's there. I'm just going to quickly go over the instructions for each part and do like 1 or 2 questions with it. All right, let's go. Okay, so for this part, you have 3 parts to the listening test, and you're going to be given a recording, usually a conversation between a patient and a doctor, and you're going to have to answer some questions about it, and you're not going to be able to pause it or go back. You're just going to have to listen to it. You will be able to pause it here on the program, but you will not be able to pause it on the actual exam. So, yeah. All right, let's go to the next one. So now we're in the first part of the listening section, and this, you're pretty much just going to fill in the blanks for the notes. You're given 30 seconds to pretty much look at the notes, which is what, and then you're just going to answer the questions through the recording.
Good morning, Harper. How are you feeling today?
Good morning, Doctor. Well, to be honest, I've been feeling a bit off lately. I'm just so tired all the time, no matter how much sleep I get. I've tried going to bed earlier and even cutting out caffeine, but nothing seems to help.
I'm sorry to hear that. Fatigue can be quite challenging. Have you noticed any other symptoms recently?
Yes, actually. I've also been feeling cold all the time, even when others seem comfortable. I've been wearing extra layers and even tried using a space heater, but I still can't shake the cold. And I've gained some weight, even though I haven't changed my diet much. I even tried cutting back on carbs, but it didn't seem to make a difference.
Those are important observations.
Okay, so you just fill in the blank through the recording. It's not necessarily in numerical order, though it is often in numerical order, but just keep that in mind. All right, we're going to head on to the next section. Okay. For this section, it's identical to the last section.
I understand you've been experiencing some pain in your legs recently. Can you tell me more about that?
Good morning, Doctor. Yes, I've been having this pain in my calves whenever I walk for more than a few minutes. It usually starts after I've walked about half a block and gets worse until I have to stop. If I rest for a few minutes, the pain goes away, but as soon as I start walking again, it comes back.
That sounds quite frustrating. How long has this been going on?
It started about 6 months ago, but it's been getting worse.
Yeah, so just fill in the blank. Okay, so this section is slightly different. First of all, it's multiple choice instead of fill in the blank. And secondly, you're gonna have one short conversation, and you're only given 1 question on that conversation. As you can see, like they change up the type of doctor and the patient and the diagnosis and all that jazz that you just have to get. Keep in mind you need to find the most right answer, because some of them are just some answers are slightly mentioned, but they're not as prevalent as the other ones. So, all right.
You hear a pharmacist discussing a prescription with a patient. Now, read the question.
Your doctor has prescribed an antibiotic for your sinus infection. It's important that you take it exactly as directed, even if you start feeling better before you've finished the course. The reason we stress this is because stopping the medication too early can lead to the bacteria becoming resistant, which would make future infections harder to treat. This is a 10-day course, and you should take 1 tablet every 8 hours, so it's essential to keep up with the schedule. Also, be mindful of any side effects, like stomach upset, and take it with food if necessary. If you miss a dose, take it as soon as you remember, but don't double up the next dose.
I'll make sure to follow these instructions carefully.
Okay, so just filled in the blank purely based on that. So we're going to go to part C. This part is pretty similar to part B in the sense it's multiple choice, but instead of having like one conversation and then having one question, you're just going to have one big conversation and then have like 5 or 6 questions on that topic. So I'll walk you through one question because there's 2 parts to this. And yeah.
You hear a presentation by a dietitian called Sarah Collins, who's discussing her work with diabetic patients, including a woman called Jane. You have 90 seconds to read the questions.
My name's Sarah Collins, and I'm a dietitian specialising in helping patients manage their diabetes through proper nutrition. Today, I want to share with you the kind of work I do and discuss a particular case involving one of my patients, whom we'll call Jane, to highlight the critical aspects of dietary management in diabetes care. Let's start with some background. Diabetes is a chronic condition affecting millions worldwide, with type 2 diabetes being the most common. It's characterized by high levels of glucose in the blood due to insulin resistance or insufficient insulin production. Managing diabetes involves more than just taking medication. It requires a comprehensive approach that includes lifestyle modifications, particularly in diet. Diet plays a crucial role in managing this condition, and as a dietitian, my primary goal is to help patients make dietary changes that can improve their blood glucose levels and overall health. Many people think that managing diabetes is all about cutting out sugar, but it's far more complex than that. It involves balancing carbohydrates, fats, and proteins, understanding portion sizes, and timing meals correctly. One of the key aspects I focus on is helping patients understand how different foods affect their blood sugar and how to make choices that keep their glucose levels within a healthy range.
Okay, like I said, this is similar to this idea that you need to pick the most right answer, since she does briefly touch on this idea that medication alone can't control blood sugar, but she does stress a little more the idea of involving sugary foods. And especially since she's a dietitian, that also implies something as well. All right, we're going to go to the next part of the listening. And
you hear a presentation by Dr. Emily Carter, a pulmonologist, discussing her work with patients who suffer from chronic obstructive pulmonary disease, COPD, focusing on a case involving a man named Robert. You have 90 seconds to read the questions.
Afternoon, everyone. My name is Dr. Emily Carter, and I specialise in pulmonary medicine, particularly in the management of chronic obstructive pulmonary disease, or COPD. Today I want to talk about this chronic condition and share the story of one of my patients, Robert, to illustrate the challenges and strategies involved in managing COPD. Let's start with some background on COPD. COPD is a progressive lung disease that makes it difficult to breathe. It encompasses 2 main conditions, emphysema and chronic bronchitis. The primary cause of COPD is long-term exposure to irritants that damage the lungs and airways, most commonly cigarette smoke. Other factors include exposure to air pollution, chemical fumes, and dust. The disease develops slowly, and symptoms often do not appear until significant lung damage has occurred. These symptoms include chronic cough, shortness of breath, wheezing, and frequent respiratory infections. Unfortunately, there is no cure for COPD, but it can be managed with the right treatment and lifestyle changes. Now, let me introduce you to Robert. Robert is a 65-year-old retired construction worker who was diagnosed with COPD 5 years ago. Like many of my patients, Robert has a long history of smoking, having started in his late teens and continuing until his mid-50s. By the time he sought medical help, his symptoms had become quite severe. He experienced constant shortness of breath, even at rest, and found it increasingly difficult to perform daily activities such as walking to the store or climbing stairs. Robert had also developed a persistent cough that produced a significant amount of mucus, which he found both distressing and embarrassing.
Okay, both of these are also examples. She did touch on this idea that there was a bit of shortness of breath. She also did touch on that air pollution and chemical exposure can also cause COPD, but the one that she said was most common was long-term smoking. So, yeah. All right, we're going to go to the reading section. Okay, this section is, we get a read, in case that wasn't obvious in the reading section, but this is where you just pretty much are given info and they're asking which text would you find it. So, for example, in which text can you find information about different classifications of blood pressure? And usually it's kind of in the title, I'll be honest with you. So the American Heart Association classifies blood pressure into different categories. So that'd be text B. We'll do one more, because why not? These are pretty easy. Okay, in which text can you find the causes of primary hypertension? Hypertension, definition and causes. Fancy that. And then you could say the most common cause of hypertension is primary or central hypertension. I feel like it's a little repetitive, but yeah, I didn't make the test. Which has no identifiable cause. But it is linked to genetics, diet, and lifestyle factors. So then text A. All right, let's move on to the next part of the reading section. Okay, this part is kind of similar to, oh my gosh, it's similar to one in the earlier part of the test, in part B actually of the listening section, where you're given in this case, you're given a small reading section instead of listening section, and then you have a multiple choice about it. So here it says, prioritize hand washing with soap and water for all patient interactions. Now, is this true? You should do this, but it's not explicitly stated here. It just says that alcohol-based hand rubs are recommended as a preferable method for hand hygiene. So probably not that one. Wash hands before and after touching a patient, regardless of visible contamination. That's what it says here. Use hand rubs only when there's no direct patient contact. That would make no logical sense, but I mean, you can wash your hands whenever you want. Just please wash your hands before touching people for surgeries. That would be really bad. All right. Okay. And then here we go. We'll do one more. So this is on the vaccine policy for healthcare workers to receive an annual flu vaccine, and they have to report any adverse reaction to the vaccine within 24 hours of administration. And that's the answer to that. So let's go on to the next section. Okay, this section is so fun. It's reading essays. It's my favorite thing in the whole wide world. But this, usually you can use the title for help. We'll just do 2 questions for this one. So what is the primary focus of the text? Wonder what it is. It's probably the benefits of procrastination. Nah, it's the psychological reasons behind procrastination, just as it is in the title. We'll do one more. Present biased. Here it says, which is the tendency to prioritize immediate rewards over future benefits. So the preference for immediate rewards over future benefits. It's literally verbatim from the text. Okay, we're going to go to the next. We unfortunately have to read 2 essays. I know, they're trying to torture us. But okay, this one, what's the main topic of the test? I wonder what it is. It's like legit there. Okay, which is the most best described to the public transportation system? I have to move this system of the early 19th century. It's the advent horse-drawn buses and trams, yada, yada, yada. They were slow and uncomfortable. It's that one. Okay? Okay. So this one is the writing section, and you're given the writing case notes, which is here. You're given pretty much just notes on a doctor's visit. In this case, there's like 3 doctor's visits, and you have to write a referral. The referral has to be like 180 words to 200 words, so it's not super long, and you're given like 30 minutes. So it shouldn't be that big, crazy amount of stress for that. But yeah, just make sure to use the letter format and use the relevant notes and complete sentences. So just you're writing a letter. All right, let's march right in. to this. Okay, this I am going to just pause the video because you don't want to watch me type really slowly. I feel like that would be really boring, and I'll just type it up and read it to you guys when I finish. Okay, here's the letter I got. Is Dear Dr. Wong, I'm referring Mr. Jacob Chen, a 32-year-old software engineer, for further evaluation and a definite diagnosis of his persistent lower gastrointestinal symptoms. I said that wrong. Just forget about that. Including consideration of colonoscopy. Mr. Chen initially presented on the 15th of April 2021 with a 3-month history of intermittent cramp, pain in the lower left quadrant, abdominal bloating, and alternating constipation and diarrhea. He denied reacting rectal bleeding, weight loss, or fever. On examination, his abdomen was soft with mild left lower quadrant tenderness, while bowel sounds were normal and no masses were palpable. He was commenced on buscopan 10 milligrams 3 times daily and advised to follow a low FODMAP diet. Oh my gosh, I can't speak today. Blood investigations, including a full blood count, C-reactive protein, and a celiac screen were all normal. At a follow-up on the 29th of April, his symptoms persisted despite partial improvement with dietary modification. Stool tests for parasites and occult blood were subsequently arranged and returned negative. Today, Mr. Chen reports only minimal improvement. His food diary suggests possible lactose intolerance. Accordingly, I have advised a trial of lactose-free diet and increased dietary fiber. Given his persistent symptoms, despite conservative management together with his family history of colon cancer in his father at age 60, I'd appreciate your assessment and any further investigation, including a colonoscopy if indicated. Please do not hesitate to contact me if you require any further information. Yours sincerely, Dr. Smith. And the word count is 218. It's slightly over the word limit, but I doubt they're going to kill me. Because if you write 18 more words, it'll be okay. And yeah, so that's how you do the first 3 sections of the occupational English test for the practice test. But this is also very, very similar to the actual test. I will do one video just for the speaking because it's a little more interactive and there's a little more nuance to it. So I'll go over that. That'll be our next video that I'm going to release. But it would so be on the lookout for that. And yeah, thank you all for being here. Have a good rest of your day.